Congresswoman Hayes, you're recognized for 5 minutes.
Thank you. Thank you, Secretary Cardona, for being here today and for your seriousness at focusing on the issues at hand. But I will say that is a very nice blue suit that you're wearing. I was also happy to hear today in committee that Mr. Banks, like myself, also cares about making sure that children have warm meals when they go to school. It is something that is deeply personal to me and an issue that I am committed to fighting for in this Congress. So looking forward to some bipartisan support on this issue. But I'd like to switch gears today and focus my questioning on early childhood education. The Head Start program is one of the greatest anti-poverty initiatives in American history. 6 decades after its founding, Head Start has served 38 million children, including me. Head Start participants are 12% less likely to live in poverty as adults and 29% less likely to receive public assistance. Connecticut has 86 Head Start and early Head Start centers serving approximately 5,000 children. Unfortunately, in 2019, about 100,000 children lived in poverty in Connecticut, which means that around 95,000 children did not receive access to early math and reading readiness or immunizations, dental, and medical care that Head Start provides. Nationally, only 10% of eligible children and their families have access to Head Start programs. In the fiscal 2024 budget, President Biden allocated $500 million for a demonstration program in the Department of Education to create or expand free, high-quality preschool in schools or community-based settings, including programs like Head Start, for children eligible to attend Title I schools. In the State of the Union, I was especially pleased to hear President Biden make the case for universal pre-K and raises in teachers' pay. He said, and I quote, "The way to put America back on top and create the best educated workforce is to make it so preschool for 3- and 4-year-olds is universal." Dr. Cardona, I know you understand that the earlier children attend school, the better their academic outcomes are, and the quicker parents can return to the workforce. Can you tell us about what policy the department is putting forth to improve access to pre-K for kids?
Absolutely, thank you for that. And you know, as teachers that we are, we recognize and we saw in our classrooms the students who had access to it and the students who didn't. And oftentimes, the students who didn't required some level of intervention to catch up. We, as you mentioned, have in our budget a proposal for close to $500 million to expand preschool and early childhood experiences. And we at the department recognize that it's incumbent upon us to work with HHS to make sure that we're connecting the dots and that we're modeling what we want to see in our states. Early childhood education is critical, especially when it's connected to the K-12 system, so that the experience that pre-kindergarten students have, whether that's run through HHS and their programs or the programs that are run in the community, are connected to the kindergarten program, so the students and educators the educators are communicating so that the student's experience is a positive one. We're big on the science of how children learn best. We know the science around how children learn best, play-based activities where they're using oral language. I can continue, but I'm sure you have other questions. It's an area of passion of mine.
Well, no, but I would like to give you some time to address the outlandish statement that was made on this committee today. Quote, "If me and my homeboys decided to become girls and expose ourselves to your daughter, how would you feel about that?" End quote. I just want to say it for the record that no Democrat, no functioning adult wants that. And you, Dr. Cardona, as a public school teacher, a public school administrator, as the parent of public school children, can you tell us what policies the department is putting forth to support all students who attend our schools?
Right. Well, you know, some of those comments, I think, are doing exactly what I warned us. We should be focusing on what the American people are asking us for. They're not asking for divisive comments. They're asking us to work together. Student safety is of primary importance. Making sure that students are accepted in schools and acknowledged for who they are is critically important. In this country, we're seeing a lot of attacks on specific students, especially students who have already experienced the most need for mental health support. So we need to stand up for all students and make sure that all students have a place in our schools.
Thank you, Dr. Cardona, and I appreciate you bringing forth data that talked about the rates of student suicide, because I've been one of those teachers on the receiving end of just heartbreaking stories when students are breaking down and saying that they just don't know what to do next. And many teachers around this country are the ones who pull those students back. So again, thank you for your time. I yield back.
Thank you.